What are the common side effects of bispecific antibody therapy, and how are they managed?
Because bispecific activates the immune system and engage T cell to kill the tumor cell, there is a couple of immune reactions. The main immune reaction is called the cytokine release syndrome. What happens there? When these T cells are activated and proliferate, they release molecules in the bloodstream and around, which are called cytokines, which help them to proliferate, but which also create a reaction in your body. This reaction may involve fever, which is cardinal and always here, but also variation in your blood pressure, decrease in your blood pressure, sometimes decreased oxygenation of your lung, being short of breath. And when it's more severe effect, you have a malaise and the need to be hospitalized, admitted for hydration, and eventually using drug to fight against that. So the side effects are common during the first treatment with bispecific, during the first injection. So both bispecifics and other in development always use what we call step-up dosing, which means that the first dose of the bispecific antibodies is a very small dose. Then the second dose 1 week later is a higher dose. Then the third week, a higher dose to avoid major CRS. So still those happens, and we have both prevention, prophylactic measures, such as drugs that will prevent this activation, but also, if they happen, way to refrain the severity of the bispecifics of this CRS. Overall, what we aim to do is to deliver these drugs as outpatient. However, when we get to the higher dose, we may need to admit patients for 24 hours to be on the safe side, particularly patients that are older or patients with comorbidity or patients we don't have a caregiver at home or enough support to be in relationship with the hospital. But what we organize is really a care that will allow the majority of patients to be always linked to the hospital, always communicate with our care team in order to continue to manage patients with a limited grade CRS, what we call CRS grade 1, at home and being monitored actively to prevent those. So that's the first major side effect. There have been description of neurological side effects, the same one we see with CAR T cell. We call that immune cells side effect, associated neurological syndromes. These are very rare, only 2-3%, rarely very severe, and it's a little bit unclear how they authentical side effect. There are two other important effects to know. One is that bispecific deplete normal B cells from the body of patients. Actually, this patient unfortunately already have B cell depletion from previous treatment. But because of that, they are more vulnerable to infections, and they will have also no efficacy of any vaccination during the treatment, but also several months after the treatment. So we have, first of all, to consider that if possible, patients should get some vaccination before the treatment, because that will avoid flu, pneumonia, COVID, shingles, and other disease. So being vaccinated before receiving this treatment is important as a safety, because it won't work and because of this vulnerability. And we will also recommend usually some prophylactic antiviral drugs, antibiotics eventually, for patients to prevent these infections and monitor them closely. Sometimes there is also a decrease in white blood cell, but that's temporary and very different from the one we observe with chemotherapy. Overall, most patients receive this treatment in the ambulatory setting, and we do manage the side effects quite nicely or quite wisely, I will say. They occur mostly the CRS during the first cycle, so during the first 3-4 weeks. They are very rare afterwards. And I will say the experience that patients report to us is that this is an easier treatment than most chemotherapies they have already received.